I'm Hank Milius, President and CEO of Meridian Health Services. I'm going to talk a little bit about our services, a little bit about the culture that we are faced with, and working together on how we may help with that. Now, how many farmers in the room understand the farming industry? Oh, come on. You recognize this, hopefully, if I can get this to move. You recognize that, I hope, right? Are those silos? Now, if you're a healthcare provider, what else do you see? You see our healthcare system pretty much, don't you? We have everything out there. We have pediatrics, psychiatry, oncology, cardiology, rheumatology, every ology. And with that, we're challenged with how we put this together because we're living in silos. We can talk about money, we can talk about funding, we can talk about collaboration, but we still work in silos, much to the result of our reimbursement structure, quite frankly, on a fee-for-service basement. Meridian is trying to do a whole-person health approach, trying to bring together and break down these silos. And this video clip will give you some understanding of that.
At Meridian Health Services, we believe the apex of healthcare is only reached with a balance of physical, mental, and social well-being for whole-person health. This is the new, integrated, and holistic approach our communities need. So we are creating a new wave of thought in healthcare. We are making a different kind of splash, a special kind of difference. And so far, we have over 32,508 patients served this year in 39 counties, 545,097 outpatient visits in 41 facilities, 95% satisfaction rate. All of this while providing $4 million worth of charity care to 2,991 people who otherwise could not have afforded it. More than 270 school partnerships bring services to more than 17,068 students. Sure, these numbers are impressive, but they're just a drop in the bucket compared to our real achievements. The people, families, neighbors, and communities we've made healthier. Consider that for decades, health was addressed in three distinct buckets: physical, mental, and social. Instead, Meridian is redirecting the stream of conversation, redefining true community health. We treat these buckets as part of a wide spectrum of integrated services, which, when pulled together, lead to holistic health. Today, 1/3 of all visits to primary care doctors involve behavioral health issues. 70% of all behavioral medications are prescribed by a primary care doctor. Why wouldn't we pool the efforts of psychiatrists who specialize in these issues and primary care doctors to address them together? So we did. At Meridian, we have created a medical home in which our family of doctors and clinicians across various specialties talk with each other within the same comprehensive health system, under one Meridian roof. Imagine being at the center of a network of healthcare professionals who dive deeply into all facets of your health. Meridian Health Services makes this possible, and the result has created a ripple effect of healthier patients with healthier neighbors, the neediest of which can find the health services they need. That is the real story of Meridian's success. We are all in this for a purpose, to help make our communities healthier. This is Meridian Health Services.
So our approach, because we can't control the funding and the reimbursement system all the time, is to work within as much as possible. We know 70% of all medications prescribed by primary care are 70% of all psychotropic medications are prescribed by primary care docs. 1/3 of all their visits are behavioral in nature. And a very vulnerable patient population, those that may be chronically mentally ill, have 25 years less life expectancy due to the lack of primary care resources due to higher rates of diabetes, hypertension, cardiovascular disorders. So we're not perfect. This is a journey. Anyone who tells you we're integrated is not really there yet because this is new to everyone. But we're trying to assimilate physical health, mental health, and social health, and hopefully have that patient experience that, not just work in silos, that much like we are today. One concrete example of that is Walnut Commons right here in downtown Muncie. We did a collaborative effort with the developer. They created a 44-unit supported housing development. All of these people in this building are Meridian patients, whether it's behavioral or addiction disorders. Some of them may have 25 years less life expectancy for lack of primary care, but we've embedded a primary care clinic within that building, which is now open to downtown Muncie too. So all under one roof, social being housing, physical health with the primary care clinic and, of course, Meridian Behavioral Addiction Services. So that's our strategy. But then I also think about, well, geez, what are the barriers to trying to implement this strategy, not just for ourselves, but for the community? When I think of strategy, I'm often reminded of Dr. Peter Drucker, when he says, culture eats strategy for breakfast. So what kind of culture have we created? What are the iconic moments that have gotten us to where we are today? When physicians in the past have recommended particular cigarettes because it's less irritating to the throat, when we have sports heroes endorsing tobacco products, when sugar industry is saying if you want to stay slim and fit, have some Domino's energy for an energy lift. And what are we doing for our kids in the morning now? Just to get them going for school. This particular physician from Chile and also a senator just introduced legislation to regulate food back in 2007. Fortune magazine said, is fat the next tobacco? Really? What makes us think that? I'm loving it. Supersize me. Okay? This is the culture that has come before us. And what about substance abuse? How did we get there? I love this one. By the way, Mom, when it comes to toddlers, if they like to be coaxed to drink their milk, try this. Add some Heineken to the milk in equal parts, pouring the brew gently into the milk. It's a wholesome combination, and it works. Make Heineken a family drink. You like it, it likes you. What are we doing today that 20, 30 years from now we're going to be laughing at, saying, I can't believe we did that, right? And we are a culture of immediate gratification, instant solutions to problems. That's our capitalistic system in many ways, that's okay. But what else does it do for our medical system? Well, if you want to stay fit and slim, take some amphetamine, right? And if your child has a toothache, try a cocaine toothache drop. All of this resulting when we want to do pain management with the U.S. being the #1 ranked country in the world, and our population is very small compared to the world in terms of prescribing opiate prescriptions. And as a result, 78 are dying every day on the average. Now, Meridian has its roots in behavioral health and addiction treatment. Bruce Rector, in fact, here, did a great job in our addiction center there for a while. We serve over 8,000 individuals. And over 400 are in medication-assisted treatment programs, outpatient treatment programs. That is not enough. No one organization can be all things to all people. We opened up a 30-bed residential treatment center in Richmond last year. We hope to open one up in Lafayette by the end of this year. So we're trying to do our fair share, but it takes a village, like Jeff said. Here's the problem when we deal with this issue and you're innocent. What if you're pregnant and addicted? There was a study by the Indiana State Department of Health, just local hospitals there, 4 hospitals. They looked at 301 umbilical cords that tested positive for opiates. That's twice the national rate. Twice the national rate. Okay, why is Meridian involved in this?
My name is Terry Milius, and my husband is Hank, CEO of Meridian. I heard about the cuddling program at IU Ball Memorial and looking for volunteer opportunities. As a teacher, I've always enjoyed being around children, so this just seemed like a perfect fit. As a volunteer, you are comforting, soothing, swaddling. There's just a variety of roles that you serve. I didn't expect to see such distressed infants that had special needs. These babies were having withdrawal from addiction. As a community, we need to care about supporting these people and these families when they go home and they have to deal with not just the challenge of having a newborn, but the challenge of having a newborn that might be still under withdrawal of some type, or just their own addiction. As a parent, that's just too much without any kind of support system. There's a stigma that goes along unfortunately, that led to a lot of brokenness within the family. And oftentimes you feel alone, and you just are waiting for someone to just kind of take you by the hand and show you how to get out. My hope is that there is a next step, that there is support that can be given to these families dealing with these challenges so that they can become a healthy, thriving family within our community.
That was a videotape from a Realzor Charity Benefit Gala. We focused on maternal treatment at that particular time. My wife has the greatest volunteer job in the world. She goes to IU Health. They have a great NICU over there, great staff, great hospital, and she comes back just with a smile every day when she comes back home. She came back home one day and she was mad. She was angry. She was pretty pissed off. And she said to me, "Hank, do you realize babies are being born addicted, dependent upon drugs?" I put my CEO hat on. I said, "Well, it's a national challenge. It's a healthcare issue. It's a public health epidemic. We're doing the best we can." "Well, what's Meridian doing about that?" "Oh my gosh, Terry, we've got OBGYN, we've got primary care, we've got whole person health care, we've got the largest behavioral health system in the area. Of course, we're doing everything about it. Don't worry about it." Next day, I talked to my executive staff. "What are we doing with addicted babies?" "Nothing." "Well, I got to point a finger elsewhere now, don't I?" So I call up Mike Haley over at the hospital as the CEO before Jeff at Ball Memorial Hospital. Mike, do you realize you have addicted babies up there in the unit?" "Oh, it's a national tragedy. It's a public health epidemic. We're doing the best we can." "What do you do after discharge?" "I don't know." I bring this up because this is the silos that the healthcare community lives in. We have two great organizations, great hearts, great minds, good people wanting to do the right thing for the patient. Perfect. The reimbursement structure doesn't incentivize that. We don't know what's going on after discharge necessarily. They don't know what resources are available, if any, and the patient falls in the cracks. Well, we decided we had to do something. We did. And again, Meridian cannot be all things to all people. And this is a perfect example of a whole person approach where you bring in a multidisciplinary team from the community. And it includes sometimes a physician, a nurse, a behavioral clinician, and on the social health aspect, DCS, the prosecuting attorney, where we can wrap our resources around that patient, that individual. Sometimes leverage them to come to treatment versus jail. Bringing all the resources together in the community to help in this. And how are the kids feeling about it? Feeling pretty pumped. Okay? I'm just going to end on this note. No one organization can be all things to all people, including Meridian. As much as I believe in Meridian and how I think valuable we are, IU Health can't do it alone. Henry Community Health can't do it alone. All great organizations, St. Vincent's Community, Open Door, everyone. We all have to pull together and bring our best resources together and make it happen.